My name's Carrie Siegel, and I'm a professor of radiology at Washington University in St. Louis. I'm in the abdominal imaging section, and my area of interest is genitourinary radiology. When a man feels a lump in his scrotum, the first imaging test is going to be ultrasound. Now, ultrasound is going to be a high resolution ultrasound exam where the probe is put right on the scrotum, so we get very, very good detail. The majority of lumps and bumps that patients feel are going to be extratesticular lesions. And extratesticular lesions in the scrotum are overwhelmingly benign. Intratesticular lesions can either be solid or cysts. Intratesticular cysts are benign. So once we get to solid lesions in the testis, then we're getting into the index of suspicion that it could be a tumor is higher. So the main role of ultrasound is to determine, is the lump or bump or mass that the patient is feeling, that you're feeling, is it inside the testes or is it outside the testes but in the scrotum? If it's outside the testes, it's usually benign. When it's inside the testes, if it's a cyst, it's usually benign. And if it's a solid lesion, it's a little bit more complicated. Risk factors for men that we like to be aware of when we're doing testicular ultrasound is incomplete or undescended testes, a family history of testicular cancer, a history of infertility, or a testicular cancer on the contralateral testes in the past. Almost all testicular cancers that we look at involve men that are less than 40 years of age. When we're looking at older men, when I mean over 60, solid lesions that we see in older men are rarely testicular cancer and are often lymphoma or metastatic disease. In general, of the testicular tumors, they come in two types: the seminomas and the non-seminomatous germ cell tumors. They each have characteristic looks on ultrasound, and the majority of the time we are able to measure and characterize these lesions quite effectively for the referring provider. There are other lesions that can be in the testes and can occasionally be tricky and can fool or be mimics of testicular cancer. Many of these we're well aware of and we know what they look like. Some lesions like a prior infarct, just like a man could have an infarct in his heart, men can have an infarct in their testes where there's a lack of blood supply. And a section of the testicle can lose its blood supply and sort of collapse and change its sort of echogenic pattern and look more like a mass. A hematoma or a bruise of the testes can sometimes look like a tumor. Infections that are either orchitis or more local orchitis or an absolute abscess in the testes can sometimes look like a mass. Occasionally, when we're uncertain if a lesion is a tumor or a benign lesion, we may have to try a few other tricks or aspects of our tricks in our bag that we might want to use. For instance, testicular tumors sometimes have abnormal serum markers. We might need to look at those to see if that will help us. Rarely a patient might need a CT scan to look for underlying malignancy that might help us with the testicular mass. Prior studies are super helpful. Every once in a while, a patient will have to go on antibiotics for a month and then come back and get a repeat ultrasound to see if whatever this mass is has quieted down, shrunken, and is less worrisome. Very, very rarely men will have to go on to testicular biopsy. But as I said, the majority of the time with lumps and bumps in the testes are going to be extratesticular and benign. And if they're intratesticular and cystic, they're going to be benign. If they're intratesticular and solid or mixed solid and cystic, those are the lesions we need to be more careful of. And about 99% of the time, we on ultrasound are able to really characterize these confidently. One thing that is important that for you to know when your radiologist is doing the exam. When you feel a lump or bump, a radiologist could bump into a cyst or a varicocele, which is like a dilated vein, or other processes in the scrotum. And it's very important for the radiologist to correlate with you, the patient. Is this the lump or bump you're feeling? Because there could be two lumps or bumps in the scrotum. One is the one you're feeling, and one is the one the radiologist has initially identified. So at the end of the exam, it's important to have a conversation with the patient and the radiologist together to make sure that whatever we have identified that we think is what you're feeling, to make sure that correlates. Otherwise, we need to keep looking. Sometimes there'll be an epididymal cyst, which is a cyst in the epididymis, which wraps around the testes, and a varicocele. There could be two separate abnormalities, or there could be a tumor in the epididymis and a tumor in the testes. So we really need to sort of correlate to make sure that we get the lump or bump that the patient that you are feeling, and we make sure that that is examined in a very thorough way.